Recently, the Centers for Disease Control and Prevention announced tooth decay is on the rise in preschool-aged children. If left untreated, it can lead to problems associated with speaking and learning. This morning, Dr. Lisa Jacob with Dell Children's Medical Center is here to help. Good morning.
Good morning, Erin.
So first, tell us, why is that? Why is the problem getting worse?
It's getting worse because there's more access to juices and sugary snacks, and our kids are getting more used to having these sugary drinks all day long. They're drinking their sippy cup all day long, and so their teeth are constantly exposed to the sugars in the juices. We're only supposed to have 4 to 6 ounces of juice for children a day, and many children are getting a lot more than that.
So the first step, when should a child first see the dentist? At what age?
The American Academy of Pediatric Dentistry and the American Academy of Pediatrics recommends that a child be seen by age 1. Actually, they should come in when their first tooth comes in within 6 months of that. And the reason for that is we want them to have healthy habits early and start good toothbrushing habits when they're very young.
If a child or if a parent doesn't take care of their child's teeth, what could happen? What are the threats that they could face?
The threats are that they could get dental decay, which could cause their child to have insufferable pain, and they could lose hours at school. Number one reason a lot of children miss school is because of tooth problems. They can actually end up in the emergency room. I work at Dell Children's Medical Center, and I see a number of children that come in because they had a tooth that wasn't fixed and they have a cavity.
Like you say, you see some of the worst cases.
Yes, I work with medically
area.
complex children. I'm at the Craniofacial and Plastic Reconstructive Surgery Center at Dell Children's, and I said children with cancer, those that have had cerebral palsy, cleft lip and palate, so I really do see the ones that are really sick, but they need dental care just like the other children do as well.
And before we came back from break, you were telling me that it can be the #1 problem for kids missing school.
It's true. A lot of children are missing school, and not only are they missing hours at school, their parents are missing time from work, so it's a big problem. And dental decay is the most preventable disease. Not a single child should have dental decay in our country this day.
What are some tips? Because I know as a kid, you try to get out of brushing your teeth. You try to say, yes, Mom, I did it, but you really didn't. So what are some tools that parents can have to help?
Right. Well, there's a lot of apps on the phones that you can use now to help them, because you're supposed to brush twice a day for 2 minutes. If you have a young child, you can cradle them in your arm, and you can have them brush their teeth for them. And you yourself are the best model, because your children mimic what you do. So you want to brush your teeth, you want to floss your teeth every day, and make your children know that that's just as important as taking a bath every day.
I think I've heard of some parents maybe singing a song or playing a song.
Exactly. There's the apps on the phone can play songs, or you can pick their favorite song, and it's usually 2 minutes long for most songs, and they can brush the whole time, and they can dance and sing.
And I want to quickly mention there is a symposium coming up in our area so that dental experts can tackle some of these issues. Tell me a little bit about that.
Yes, on April 19th, I'll be hosting the 3rd Annual Central Texas Dental Symposium at the J.J. Pickle Research Center, and we have 250 oral professionals all over Texas that are coming to learn more about how to manage dental disease, and we want to work together and see the best way to tackle this problem and learn more about taking care of patients that are medically complex.
All righty. Thank you so much for being here this morning.
Thank you very much, Erin.
Some good tips for people out there. All right, David, do you like going to the dentist?
I'm not sure.